A clot in the leg has to be defined in terms of which part of the circulation that clot is in. There's an arterial side of the circulation which carries blood away from the heart and down to the leg, and there's the venous side of the circulation which carries blood away from the leg and back to the heart. A clot in either of those systems will present itself in a very different way, but the common theme will be that there will be a very sudden onset of pain. If we deal with the venous side first, that is an entity that is described as a deep venous thrombosis, or a DVT. A DVT is formed because of a period of immobility, for example, a long-haul flight. Some patients are more predisposed to forming a thrombus or clot in their veins. The other associated symptoms that a patient would notice is swelling and maybe redness in the leg. But the other key thing around this will be the history. So there may have been a history of a recent flight, for example, a period of dehydration, a period of recovery following an illness. If this is suspected, one should attend the accident and emergency department, where investigations will be done, a number of blood tests and a scan to define whether that is the diagnosis and exactly where the clot is. The next stage of that would be to treat that, and that would be through what we call anticoagulation or blood thinning medication, and that would be continued for a period of 3 to 6 months. If we look at the arterial side of the circulation, one can imagine that if you cut off the blood supply to the leg, you will not get swelling, but you'll get a painful and very pale leg. The other thing that one would complain of is the inability to move or feel that leg. And when a clinician were to examine that leg, there would be no pulse in the leg. This is a medical emergency, and you would have to attend the accident and emergency and be referred onto a vascular unit immediately. If action would not be taken in the next 6 hours, you run the risk of losing that leg. The idea would be to investigate where the clot would be and use either endovascular techniques. So what I mean by that is wires, balloons and catheters to try to remove the clot, or conventional open surgery to fish out the clot and restore the blood supply to the leg. Thereafter, one has to do things to prevent these problems, and again, risk factor modification in the form of blood thinning medications such as aspirin and cholesterol lowering medications such as atorvastatins, or more commonly known as the family of statins, would need to be prescribed.